Hi, I'm Dr. Ed Shawopski. I'm one of the surgeons at Twin Cities Orthopedics. I'm also a founding member of the group. I specialize in total joint replacement and also perform fracture care and arthroscopic surgery of the shoulder and knee. Well, don't forget the simplest pain reliever of all, a bag of ice. If you put ice on your arthritic knee or arthritic hip, it will help. Over-the-counter medications like Tylenol or Advil or Aleve are also helpful. If you have any history of ulcer disease or kidney disease, you shouldn't take anti-inflammatories. And if you're over 70, you should probably talk to your internist before you take anti-inflammatories. Also, oftentimes a temporary use of a cane is very helpful for relieving your pain. And if you don't know how to use a cane properly, we can set you up with one of our physical therapists to demonstrate how to use it well. Generally, joint replacement is a pain relieving procedure. You have your joint replaced when it's hurting you enough to have it replaced and when simple things don't work very well. So, for instance, we usually ask you a series of standard questions. Does your sore knee or your sore hip wake you up at night? Most people don't want to tolerate that very long. How far can you walk? Can you get up and down steps? Are you having difficulty getting in and out of a car? With arthritic hips, a common problem is difficulty trimming your toenails or reaching to put your shoes and socks on. When you have those problems that are bad enough to be affecting your life and your decision-making process and what you do from day to day, and when simple things like a medication or an injection don't alleviate those symptoms, then it's time to talk to your surgeon about having your joint replaced. I'm frequently asked, Doctor, I have a little arthritis in my knee. What can I do to make my knee last longer? There are several things that are very helpful. Probably the biggest one is if you're overweight, try to take off some weight. I've had many patients who, if they take off 50 pounds, put off joint replacement for 2 or 3 years just because their joint is not loaded. Another thing is to keep your muscles strong. If you keep your lower extremity muscles stronger, your joint functions better and you have less pain, and oftentimes you can put off surgery. Sometimes we send patients to physical therapy to learn how to do it right. Well, first of all, you need to understand that these days the length of stay is very short. 95% of our patients are going home the next day. For lower extremity joint replacements, most patients are going home using a walker. Some of our younger patients will use crutches. Most people have advanced from a walker or crutches to a cane within a couple of weeks. By a month of using a cane, most patients only need a cane for longer distances. It's important to understand that a joint replacement is a long-term investment. It's not a quick fix, and many patients will go several months or more before the aches go away and the stiffness goes away and the joint feels like it belongs to them. So I've had patients who enjoyed walking for exercise. And 2 or 3 years ago, they were walking 3 miles 3 or 4 times a week. And all of a sudden, they're to the point where walking a half a mile is painful or going upstairs is painful. And most of these patients, after having their joint replacements, go back to those activities. And they're very happy that they can have a healthy lifestyle again.